In recent years, more and more Americans have made plain their intention at the time of their death to donate their organs so that others may live longer, healthier lives. The fact is, there are already too few organs available for the 50,000 Americans who are now waiting for an organ transplant. Having said that, what you're about to see goes to the heart of a little-known controversy that's been developing in the organ transplant community. Are surgeons taking organs from patients who are not quite dead, and in some cases, giving them drugs that might hasten death? We begin with a case which at the time seemed to be nothing more than an odd medical mishap. One spring night in Defiance, Ohio, an intruder walked into the home of Pamela James, a 33-year-old mother of two, and he fired a small caliber bullet into her brain. Emergency physicians quickly saw Mrs. James as a potential organ donor and sent her to St. Vincent's Medical Center in Toledo, where doctors pronounced her dead.
A team of physicians selectively removed one body part after another. They removed skin, they removed bone, they removed kidneys.
Attorney Dave Williams defended the man who admitted shooting Pamela James in 1987. For Williams, it was a routine murder case until one night, sifting through the victim's medical records,
I was stunned when I read the coroner's. The time of death listed by the coroner is virtually to the minute coincidental with the time they removed her heart.
Was it possible that Pamela James was still alive when her organs were removed? To help find the answer, Attorney Williams asked Dr. Jan Liestma, a widely respected neuropathologist, to examine the victim's brain.
So to me it looked startlingly normal. So we have a lower grade brain injury from which I would expect a person to be able to survive.
Williams finally reached a disturbing conclusion. It was the act of organ harvesting that had killed Pamela James, not the bullet.
The real problem in this case is that she never got a chance to survive. She was managed for purposes of harvest rather than managed as a neurosurgical patient.
Although St. Vincent's Medical Center insisted that James had definitely died before her organs were taken, the prosecutor suddenly dropped aggravated murder charges against the man who shot her, allowing him to plead guilty to a lesser charge.
It never would have occurred to me that a person could be not fatally injured and still end up on an operating table for the purpose of having their organs harvested.
With each passing year, as more people die waiting for organs, we have found that transplant doctors have begun aggressively to take organs in ways that some distinguished doctors and ethicists say is highly improper and possibly illegal. But none of this might have come to light had it not been for Peggy Rickard Bargholt. 14 years ago, she donated the organs of her 3-year-old son, Jeffrey, who had died of a brain hemorrhage.
Jeffrey's kidneys, one went to a 12-year-old, the other to a 19-year-old. His liver was transplanted into a comatose 2.5-year-old child in Pittsburgh, and his corneas went to 2 adult males. And one of them had never seen his children before.
The experience changed Peggy's life in more ways than one. Soon, she began working at LifeBank, an organ procurement agency in Cleveland. Her mission? To convince more people to donate organs. But while there, she made a shocking discovery, one that would disturb some leading medical ethicists and spawn at least one criminal investigation. Peggy had found that one Cleveland hospital was planning a protocol, a blueprint, to get organs in a very unusual way. Instead of taking organs from patients who were brain dead, as is customary, doctors were now willing to take organs from donors with severe brain damage from, say, a bullet wound.
I became aware that they were looking at patients who were neurologically impaired.
But not brain dead.
Correct.
Because these seriously injured patients are not yet brain dead, doctors would have to use an older, less precise method of declaring death, the absence of a heartbeat. And that concerns Dr. Norman Paradis, a prominent researcher who has studied this method of declaring death.
One of the things that my group has shown is that that is a much more complex and difficult state to diagnose. That you can be wrong. That you can think the heart has stopped and it hasn't.
And because organs deteriorate without oxygen, There is a premium on declaring death as quickly as possible. Some doctors say too quickly. Under this protocol, with the consent of the family, life support would be withdrawn, and a doctor not affiliated with the transplant team would declare death after just 2 minutes without a heartbeat.
You are on very thin legal ice. You are at risk of being seen as someone who prematurely took organs.
Arthur Kaplan, one of the nation's leading medical ethicists, says no one knows for sure how soon death occurs after the heart stops.
If you have a heart that might resuscitate, if you have something that might start working again, even if it's stopped, even if it's not working right now, you don't want to say that someone is dead.
What most disturbed Peggy Bargold was not just that a hospital might take organs from patients who are not dead. She also discovered that the hospital planned to give patients who were still alive massive doses of potentially harmful drugs, solely to make their organs healthier for transplant. Mrs. Bargold took her concerns about this protocol to Professor Mary Ellen Waithe, who directs the bioethics program at Cleveland State University.
We investigated for months, and the response to everyone that I consulted with was, what are they trying to do, kill them? And after you get 3 or 4 of those...
That's the question that has to occur to you if you read about this.
Yes. Well, after 3 or 4 people who knew better than I asked me, what are they trying to do, kill them, I thought, if they are, we need to get the authorities involved.
The issue to us was really unique. No one in our office had ever heard of this.
Carmen Marino, an assistant county prosecutor in Cleveland, investigated Bargold's discovery, and he was surprised to learn who was involved.
Well, the hospital in question, I know, is the Cleveland Clinic, right?
Yes.
And this is a world-renowned institution that has done so much good for so many people down the years.
Yeah, they have a tremendous history. They are an excellent medical institution.
As part of his investigation, Mr. Marino reviewed this videotape of a Cleveland Clinic doctor explaining to staff that patients previously unsuitable for organ donations could now be donors minutes after their hearts stop.
We don't want to sabotage people's belief in organ donation and also your comfort with the concept of brain death. We're not trying to say that these people are brain dead at all. They're not dead yet.
What Prosecutor Marino wanted to know, however, is whether clinic doctors might hasten the donor's death by administering a large dose of a drug called Regitine. That drug, when given just as life support is withdrawn, helps to keep organs healthy. But Regitine also does something else. It blocks the body's automatic release of adrenaline, which in critically injured patients helps the body to fight off death.
Patients who have been injured maintain themselves using adrenaline. That is vital for their attempt to maintain life.
So if Regitine is then injected, that blocks the adrenaline?
Well, actually, this is not good for the patient. It is good for the organs.
Look, these people are on their way to death.
Yes.
A lot of them.
So are you and I.
Well, I know. They're going to die.
Yes.
So
is this a philosopher splitting hairs? You bet. You bet I am. You bet I am. I'm splitting hairs. Because as good as dead is not dead. And it's not up to physicians. It's up to the legislature of the state of Ohio and the separate states to determine what our legal criteria are.
And if we make people wonder, well, they're just going to say dead enough or sort of dead or kind of dead, close enough, because they want organs. And that's what's driving the determination of death. That's not good public policy.
And it may be more than just bad policy.
I understand that you told the lawyers for one of the most renowned heart institutions in the world that you would indict them for murder.
It wasn't quite that explicit a threat. It was more like an assurance that this type of protocol results in a homicide.
What was their reaction?
Oh, they took it very seriously. They assured us that they had not used it.
Oh, they backed off?
Right, they're not going to use it.
The Cleveland Clinic declined to talk to us on camera, but the hospital said Regitine is not harmful to patients and that their protocol met the highest legal and ethical standards. The Cleveland Clinic isn't the only hospital to consider taking organs from brain-damaged patients. The University of Wisconsin Hospital has actually done exactly that in more than 100 operations. Dr. Hans Solinger chairs Wisconsin's transplant unit. He's also president of the American Society of Transplant Surgeons. Dr. Solinger insists the patients are brain dead by the time their organs are removed.
You can guarantee that the patient whose organs are being harvested feels no pain. You're sure?
I would say the patient is brain dead. A patient has no sensation. That's the definition of brain death.
But the hospital's own protocol is not nearly so certain. It says, quote, if there is doubt about the patient's ability to experience pain, it is appropriate to prescribe analgesic or pain medication prior to transfer to the operating room. The Cleveland Clinic protocol had a similar provision.
The protocol that we looked at said a morphine drip may be maintained for comfort. And the two,
Whose comfort? The person's comfort?
apparently that's who's getting it.
I think in situations where pain-relieving medications are still being given, it's a clear sign that someone does not believe that death has come.
In addition, Wisconsin gives the same potentially harmful organ-preserving drugs that the doctors in Cleveland had planned to use. Dr. Solinger said these drugs have essentially no side effects.
How do these drugs benefit the patient, who is, of course, still living when you give them these drugs?
Are they benefit patient?
So it's just to benefit the organs.
That's correct.
In addition to giving patients Regitine, Wisconsin's transplant team administers heparin, an anti-clotting drug that also keeps organs healthy. But under certain conditions, heparin can be harmful, specifically in the kind of head-injured patients being used as organ donors. Again, Dr. Liestma, the neuropathologist.
To give a head-injured person heparin just without qualification would be potentially a very, very dangerous thing, because the individual could continue to bleed inside the brain and could kill them.
And you're not only giving them heparin, you're giving them a massive dose of it, isn't that right?
It's a large dose, yes.
Standard dose is 5,000 units, yet in one of your own papers you say you give 30,000 units, 6 times the normal amount, to patients who may have serious brain bleeding or damage. Can you tell us the name of just one expert who would say that it is safe?
You know, I'm afraid we are turning things around here. It's impossible that this dose of heparin, even if it's a large dose, within the short time interval, will have a negative effect on the patient.
But brain-damaged patients don't always die right after life support is withdrawn.
If the person doesn't die on demand, if they continue to sustain a heartbeat, they are returned to the floor in the care of the attending physician. Now, is that patient better off or worse off with those medications on board? They're worse off.
The district attorney in Madison said the Wisconsin protocol did not violate any laws. Wisconsin is not alone in trying out this controversial form of organ procurement. A 1994 survey found that 1/3 of the organ procurement agencies in this country already have protocols that allow doctors to seek organs from patients who are not brain dead. And we found out that some, but not all of them, use Regitine or heparin. But the fact is that only a tiny fraction of all organs come from brain-damaged patients. And Dr. Kaplan worries that in trying to procure these comparatively few organs, hospitals may frighten away potential donors.
Organ donation saves lives. And anything that in the least bit compromises that requisite trust between families of dying people and doctors, even the hint of a suggestion that people have cut corners, fudged the line of where death is, done anything to bring death about, is going to damage tremendously organ donation in this country.
This obviously is a controversy that you do not find unexpected.
Of course not. The whole issue of organ donation has been a controversy. And whenever you individually or a group of individuals goes out on the frontiers of medicine, there will be some controversy. But I think what is important to say is that right now in the United States, 22,000 people's lives are being saved every year.
Please understand, doctors on both sides of this controversy see no reason for any of you to tear up your organ donor's card. The chances of this happening to you or some member of your family are already minuscule, and now that this controversy is finally out in the open, the chances are probably nil.